Hello, thank you for tuning in today. My name is Jeff McKay. I'll be taking you through introduction to how Secure Mail can help your health. With me today is Mark Ayer, our Director of Customer Operations at Brightsquid, who works with all of our users, professional clinicians, staff, as well as patients to make sure that everybody gets what they need out of Secure Mail. So we're going to talk today about how you can use your Secure Mail account to work with your clinics to help manage your health and sort of the implications or the ways that Secure Mail helps patients be healthier and some of the research behind that. And then we're going to show you specifically how you do those things or the parts of Secure Mail of your account that you need to know how to use in terms of sending messages and all that sort of stuff to help you do the things that will help you manage your health better through Secure Mail. Before we do get started, I just want to highlight, if you can't hear me, you should be on computer audio. If you want to dial in through a phone, you can just select that. So that's in your go-to webinar control panel. Under audio, you select those. Obviously, if you have no audio, we don't recommend that. You won't be able to hear us. This is Mark and myself. So we will be taking you through the agenda today. We're going to talk about how, as I mentioned, Secure Mail improves patient care. So how it helps you be healthier as a patient. And there really are implications across the system for the entire healthcare system. We'll talk about some of that too. We're going to look at a couple of reviews. What do patients say about us by using Secure Mail? We're going to actually look at the workflows. So here's what happens in this scenario and in this scenario and in this scenario. From your perspective as a patient, here's what you would be doing in terms of certain jobs. And here's what it looks like on the other end. So you can understand what's involved for the clinic. And the intention here is to just show that, there is a bit of work involved, but it is a pretty easy process to use Secure Mail. And we'll talk about the benefits for the clinic as well. So improvements in patient care. So clinics are actually able to manage patient care more effectively and more efficiently. And there's lots of research on this, and we talk about this every month, but there's an 11% increase in clinic capacity. We've seen clinics actually double the number of patients they can see in a day. So, the real benefit here is system-wide, and it starts with the individual, right? If your clinic has 10% or 11% more capacity, you don't have to wait so long to see your doctor. And that has benefits across the system. So the more quickly that patients can access care, the less likely there is for the development of any complications if symptoms progress or a condition is allowed to get worse. That means that we can have fewer emergency visits, we can have fewer hospitalizations, fewer different tests, all that kind of stuff. There's just less of a strain on the system in general if we can get people the care they need more quickly. Now, patients are actually likely to see improvements from baseline mental health outcome measures. So there's research that shows there's this weird 11% number that keeps showing up in a lot of this research, which is interesting. But there's proven to be an 11 or higher percent increase in health outcome measures. So that's looking statistically how there's different ways that health outcomes are measured, and on certain charts we're able to see an improvement in outcomes when Secure Mail is introduced using communication between patients and providers. And that particular statistic shows it's just two messages back and forth within a 2-month period has an impact on your health as a user. And there's lots of reasons for that. Typically, it has to do with treatment adherence. So in our May webinar, we talked with Paul, who is a patient user who talked about the fact that now I have the notes from my doctor, I have the answers to the questions that I asked in the palm of my hand because I can log into my Secure Mail account on my phone and review what was discussed. That helps patients a lot be able to understand what they should be doing, remember what they should be doing, and ask for any clarification pretty quickly without having to remember to call in the morning. If something pops in your head when you're going to bed at night at 9:30, you can shoot a message to your clinic at that point, and they'll get back to it when they can. There is lots of evidence that shows having this type of communication can decrease depression measures. So it's a great tool for mental health check-ins. Anything, particularly nowadays, we're all feeling a bit more anxious than our baseline. And it's a good way to just have a quick check and say, hey, I'm feeling this. What do you think, doc? Or should I be worried about these feelings? That kind of thing. And it's easy for you to send a message to the patient, to the clinic, and they will address it as is appropriate. And this is what the clinics are equipped to do. They'll they'll assess your message and say, well, we really need to speak with you. We'd like you to come in. Or they might just reply via secure mail and say, let's try this and this and this. Thanks for reaching out. As I mentioned, it's shown to increase treatment adherence because of that connection. And beyond that, it actually helps you as a patient build out your circle of care. As you connect with different providers and different clinics that you work with, you now have a centralized location. We'll talk a little bit more about that towards the end. So you have a centralized location for where you can share all your information from all your providers. So just real quickly, patients see secure mail. If you haven't had a chance to use it a lot, it's easy and fast. You don't ever have to wait on hold. You don't have to come to the clinic as much. We've talked to clinics who now expect that 30% of their patient interactions will be done virtually. Now, some of that will be secure mail, some of that will be phone, some of it will be video. What we see statistically is that 80 to 85% of virtual care interactions, so anything that happens outside of the clinic, takes place using secure messaging. So that means video is a very small portion. It's kind of a last resort. Phone happens, significantly more. So phone's about 15 to 20% of that. And video consults actually end up being about 0.5%. They're actually fairly inconvenient from a technology standpoint. If a clinic's using something different than what you have installed on your computer, then you have to install it. Then you have to, you still have to align schedules. You still have to, worry about, there's all kinds of implications actually from a privacy standpoint that the clinic has to have configured before virtual care is an appropriate tool. People really like the fact that there's team access. So, the staff can manage messages much as they would a phone call, but it's way more effective because if you leave a voicemail message at a clinic, it's hard for them to share that message around. Whereas a secure message can be forwarded almost instantly to the appropriate person to be addressed. And that means that the clinic is able to be way more effective in addressing your concerns. And again, here, we just have a written record of a conversation that's good for both sides to check back on. We're going to look at some of the workflows, and Mark, I'll encourage you to chime in here as we go through these, but some of them are pretty simple. Request for a lost lab rec. Now, sometimes the lab is going to keep them stored on file. Sometimes, you're going to have a paper copy that you bring with you that, you keep in your car. I know I always find them in my car when I'm cleaning it out, but, it's a really easy way for you to send a quick message. Hey, that lab rec I got at my last visit, I've lost it. Can I get another one? And it's a simple, rather than going back in the clinic, it's easy for the front desk they can go in and they can actually find that lab rec in your record. They can export it as a PDF and just attach it to a message as you would any other attachment in secure mail. And secure mail is actually made to carry attachments. And if we look at the stats of messages sent to attachments, on average, there are about 2 attachments per message. So it's really something that happens quite a bit. And then, you can see, then you can view it in your secure mail account, or you can just actually print it. Or, if your lab is on secure mail, you can just forward it to them there. So now, one of the things that we see as a big benefit for secure messaging, there's an organization called Canada Health InfoWay that does a lot of research on digital health use in Canada and also promotes digital health use in Canada. They have research that shows that if we could replace, basic lab test result reviews and prescription renewals, we could save Canadians 47 million office visits at the doctor's office a year. So this is a big one. If there's any changes, the doctor will get your lab results. They just get sent to the doctor and part of your record, and then they can review them. And if there's any changes, either they can write you and say, hey, we got your results, everything looks great, carry on doing what you're doing, you're doing great. So this is really good for any patients that have, any ongoing chronic conditions that are well managed, but you still want to have that follow-up. You still want to have that check-in. You don't necessarily need the appointment. Sometimes it's difficult to get to the clinic. And especially nowadays, we don't necessarily want to go to the clinic. And you can have a real quick check-in through secure messaging, through secure mail with your clinic. And in this case, it's entirely appropriate for them to say, hey, looks like these levels are a bit high or a bit low. Let's adjust your dosage, or, let's try eating less cheese, whatever it may be. So it's absolutely appropriate for clinicians to send advice like that through a secure mail message. And you can see here in the time it takes, the total time for this, even if the dosage needs changing, that sort of thing, it's a very small lift for people from a time perspective. The average time it takes a clinician to respond to a secure mail message is 2.3 minutes, and the top and the longest is 2.5 minutes. So it's real easy and real quick. Whereas, you look at the average appointment time, it can be 12 minutes. So you can do a lot more patient contacts as a clinician, as a clinic. You're actually helping your clinic serve the community better by using secure mail with them more. Dermatological concerns. So there's actually a lot of this that happens. A lot of dermatology can be done, especially at the family practice level. A lot of dermatology consults can be done with a picture, and there might be some questions. So we've actually worked with dermatology clinics to increase the use of secure mail for this reason. So a lot of times dermatologists, especially at a specialist level, they want to focus on specific cases that really need to be seen in person, but they're quickly able to screen out any concerns that might be benign, that could be treated with a cream, or that just might be something that's not dangerous, that everybody can kind of move on and breathe easier knowing that they're safe. And that's a lot of times all that takes is a picture. You can easily take a picture with your phone, attach it to a secure message, and send it to your family doctor or a specialist in dermatology that you might work with. So in this sense, there's a couple of different ways to look at this. If you end up going to see your family doctor, you can say, hey, I've got this issue. They might take a picture of it themselves and send that on to a specialist, and the specialist will look and they'll make a decision on what needs to happen. So that's either you coming in to see the specialist, or they might say, like I said, they might say go get this cream, or they might say, that's totally benign. It's just a regular sunspot. It's not a big deal. Nothing to worry about. So there's lots of different applications for secure mail, but these are just kind of a few. Providing advice to patients with complex or chronic diseases. So we talked a little bit about this. So especially now, it's important to check in with patients. A lot of clinicians that we talk to say that secure mail is an entirely appropriate and very convenient and easy service and system for keeping in touch with chronic care patients. It's important to have that ongoing contact for continuity of care, for any check-ins, especially now. People might have anxiety about, hey, how does my condition put me at risk? If it does it? And should I be taking my medication, or shouldn't I be taking my medication if there's extra risk? So lots of different questions. So you can either write to your clinic with them and say, hey, I have a quick question about this. And if it is just a quick question that's not urgent, obviously, if you're having chest pains or debilitating headaches, something like that, you don't want to use secure mail. It's not an immediate form of communication, but if you have questions that are, non-urgent, secure mail is entirely appropriate to ask to send them through to your clinic, and it helps them manage things a little bit easier. They don't have to manage the phone. It actually can be a bit more difficult if they have to use the phone all the time. So in this case, it's pretty simple. If the patient writes in and says, hey, I'm feeling different now, or I have a question about how this impacts my health, or looking back, the GP gets some results and they might want to change things. But the GP might even just want to reach out. It's part of a 6-month check-in. How's everything going now? Are you feeling okay? And the patient could write back. You could write back and say, you know what, I'm feeling a little bit tired lately. And they might have some comments about that, or they might want to investigate it further and ask you a couple of questions via secure mail, or they might just call you. So it's a great way to engage with your clinic and not have to worry about trying to book a time, trying to align schedules, that sort of thing. You can just kind of let them know that you have questions, and they'll respond appropriately. So those are a few sort of general workflows that we have that we've seen work in clinics with patients. And there's lots more things. I remember sitting with a clinic one time as they were implementing secure mail. They'd been at a couple months, and they got really excited and said, they're sending us pictures. And I said, wait, what do you mean? Who's sending you pictures? And they said, patients. They're taking pictures and sending them. And it was very helpful for the clinics because it helped them triage concerns. the staff could look at it and say, oh, that needs to be seen by the doctor, or the nurse can address this, or we need to get them in to be seen, or let's set up a call. So it's really helpful for your clinics when you start to use these sort of things to give them more information up front, because you can't really leave messages in a voicemail that are any use from a diagnostic or a clinical standpoint. So with that, that takes us to our demonstration portion. So Mark, I'll invite you back in.
Actually, Jeff, I just realized that I didn't say hello at the start of the conversation. I just let you get started, and I've been sitting here listening.
I noticed that. I just want to invite you back in. I do want to say one thing quickly, Mark, and I know you're probably about to say it anyway, but if you have any questions about the workflows that we just looked at, if you have any questions about anything that we're going to talk about, there is a question section in your go-to webinar control panel on the right of your screen. You can type any questions there. We will get them to them at the end. And as a note too, if there's anybody that you think should see this, family, friends, whatever, we will be sending out the recording to you when we're done, so you'll be able to have that, and it will be published online, so it's easy to access. So take it away, Mark.
Thanks very much, Jeff. And just to follow up on something that you mentioned a little bit earlier, when it comes to using secure mail and communicating remotely with your doctor, it's not a black and white or an either or situation. We certainly would still encourage you to use the telephone. If your doctor sets up a virtual care consult for you for video chat, by all means, that's a great way to communicate. But the interesting thing about phone and video chats is in just about every situation, if there's a diagnosis made or a recommendation or a suggestion made, at the end of that phone call, there's almost always a document to be transmitted, be it a prescription or instructions or some sort of follow-up information. And that document, 99 times out of 100, is sent through Brightsquid Secure Mail. So, and I bring this up because quite often we will get questions from patients who, they'll actually say to us during our support call, is it okay if I still phone my doctor? And of course, absolutely. We're not trying to completely supplant phone calls. What we're doing is trying to provide a better way to communicate in situations where it's most appropriate. So with that said, I'm now sharing my screen, and this should all look very familiar to everybody on the phone call. This is the login to Brightsquid Secure Mail. I'm logging in on a Windows 10 computer. I'm using a Chrome web browser today. But before I log in, there's a couple of important things that I think maybe not everyone is entirely aware of. First and foremost is that Secure Mail is a web-based application that is available on any device that you might own. I mean, maybe not an electric razor, but any kind of computing device that connects to the internet and has a web browser, you can use to access your Secure Mail account. So that includes Windows 10 computers, Mac computers, iPhones, iPads, Android devices. Anything that's internet connected and has a web browser, you can use to access Secure Mail. Then there's no software to download or install. There's no apps to manage. It all just happens within your web browser. So whether that's Chrome or Firefox or Internet Explorer or Safari or a half a dozen others, whatever you use to get on the internet, you can use to get into Brightsquid Secure Mail just by going to the login page, which can be found at brightsquid.com. The URL that I'm displaying right now is for a demonstration environment, so it won't work for you. But the URL that you'll want to go to is brightsquid.com, look for the login button, and you can log in from any device. Now, with regard to login, you will always log into Secure Mail using your email address. My pretend made-up email address for today's patient is adam.able@brightsquid.com. You don't have to have a Brightsquid email address. In fact, most people don't. Only about 20 of us do. So you can use whatever email address that your doctor invited you at. So that might be Gmail or Hotmail or Yahoo, and that's all fine and well and good. If you do forget your password, and it happened to me about 3 days ago, there's a forgot password link on the login page. So you can always reset your own password. We're going to ask you for your email address, and then we'll email you what's called a password reset token that you can click on to create a new password for your account. It takes just a minute or two. You can always contact us for help. There's a contact us link here at the very bottom of the page. It's kind of small, but you can see it there, I think, under the forgot password link. And there's always this chat icon available, so you can chat with us. We're based in Calgary, Alberta, Canada. So 8 to 5, Monday to Friday, Mountain Time. So that's 2 hours behind Toronto or New York, for example, depending on your time zone. But we're always available and happy to chat with you and help you with whatever you might need assistance with. So I'm going to log in now as my pretend made-up patient. His name is Adam. So let's go ahead and log him in. And then once we get logged in, of course, we see the secure mail inbox for this patient. So this is a back and forth conversation that Adam has had with his clinic, the Fauchard Clinic at West Hills, just as an example. But I think most of you are probably familiar with this idea. I wanted to show you a couple of tips and tricks that you may not be familiar with. First of all, when you are invited to Brightsquid Secure Mail, likely by your doctor or dentist or some other medical professional, or maybe you created your own account through your provincial medical systems or state medical systems, if you're in the US, I should say. When you created your account, you would have identified yourself by your first name, last name, your date of birth, and added some other information. I've just clicked on settings here on the left-hand side, and this is the profile information for our patient, Adam. This is where I can go to update Adam's first name, last name, date of birth. We can add in things like gender, personal healthcare number, location. All this stuff is helpful to your doctors to identify that they've got the right Adam Abel per se. Now, I will point out that the only thing that you can't change yourself is your email address. That's your unique identifier in our system. And if you do need to update or change your email address, contact our support department, and I'll show you how to do that in just a minute. Now, like I mentioned, most of you were likely invited to join Secure Mail by your doctor's office. But that doesn't mean that you can only communicate with that office. So in this example, I've just clicked on the directory here on the left-hand side of my screen, and here are the two doctor's offices that Adam currently has communicated with. So there's the Fauchard Clinic Southland and Fauchard Clinic West Hills, but those aren't the only practices in Brightsquid. To be completely frank, there's about 150,000 medical professionals on Secure Mail that are available to you to communicate with. So you can actually go to this global search up here, and you can filter by city, state, province, and specialty, but you can search for a specific practice. So for example, I may want to speak with a radiologist that I know of. So I've just typed in the first couple letters of the name of the practice, in this case, Rontgen Radiology Services. And you can see here the search results show me both the practice itself, so I can communicate to it directly, as well as some of the members of the practice. Now, we always encourage sending messages directly to the practice itself. Wilhelm here may be on vacation today, so we don't want to send him a message and have it be missed. But you can certainly send a message to the organization, and then everyone within that practice that uses Brightsquid, the front desk staff, to coin a term, they'll be the ones that'll receive your message and will respond to it in a timely fashion. Really important note, if you search our Brightsquid directory, and as I said, there's about 200,000 users, but you may not find your doctor or your dentist or your chiropractor. If you can't, click this link up here and let us know who you're trying to find. Give us the practice name, the name of your doctor, and if you have it, their phone number, and then we can reach out to them on your behalf and let them know that you are trying to reach them through Brightsquid Secure Mail, and we can provide them a free account so they can receive messages from you. Now, let's cancel that because we did find our doctor. We found Rontgen Radiology. So I'm going to click this Secure Mail button here. This is how I send a message to this practice. And when I'm sending a message, the obvious things are subject line. I'm just going to type test. The body of the message goes here. I'll type test again. But quite often, as Jeff mentioned, we're transmitting attachments, files, documents, photographs, things like that. To add a file to this outgoing message that is now addressed to Rontgen Radiology, I would just click this Browse button here and browse my local computer to find a file that I want to attach. Now, these are all sample files, but as an example, I can select these two photographs and this PDF document and attach, by clicking Open, all three of those files simultaneously to this outgoing message. There's no limit to the number of files you can send. If you need to, you can send very, very large files, things like, often I'll tell doctors they can send things like CT scans or DICOM imagery, which are high resolution diagnostic images. If you have something that big, then you can certainly send it, but that seems unlikely. I will point out that I'm on a desktop computer here. So when I click on browse, my options are to attach a file from my computer. But if you have a mobile device like an iPhone, an iPad, or an Android device, when you click that browse button, it brings up the camera option. So you can actually take a photo of an area of concern, maybe a rash or a blemish on your hand or your face or anywhere else. You can take a photo of those problem areas or of a document for that matter, and then automatically attach that photo and send it off to your doctor. That can be a really easy way to send a completed document back to your doctor's office. If they've sent you a form and said, please fill in this information about your headaches and then send it back to me. If you don't have a scanner, don't worry about it. Just get out your iPhone or your Android phone, take a picture of that document and send it to the doctor through secure mail. So it saves you the trouble of having to scramble around to find an old-fashioned flatbed scanner that not many people have anymore. Last thing that I'll point out, and then I'll turn this back over to Jeff. I know he's itching to say a couple more things. If you ever have any questions or concerns about how to use Brightsquid Secure Mail, we are easily reached, and I showed you on the login page how you can connect to us through live chat and so on. But this little question mark icon up here in the top right-hand corner, it may be hidden by your GoToWebinar panel, but trust me, there's a little white question mark in a circle on the blue background. And if you click that icon, it takes you to our help and support portal. And there's an entire section here on the help and support portal intended just for patients that sort of explains all of the stuff that I was just talking about, how to attach files, how to update your profile and things like that. But perhaps most importantly, at the very bottom of the screen in big bold letters is our email address, our phone number, and of course the live chat icon is always available too. So you can always reach out to us and connect with us for any assistance you might need. Don't hesitate to call. Don't hesitate to connect with us through chat. Whatever you need assistance, 8 to 5, Monday to Friday, we're here to help. So with that, I'm going to turn it back over to my colleague, Jeff, who I think has a few more slides he wanted to share. Jeff, are you still with me?
Yeah, thanks, Mark. Let me just grab control back here. Where is, oh, there's me right there. Okay, perfect. So there's a couple things we want to talk about. So one, for patients in Alberta, you can connect your Secure Mail account to your My Health Records account. So My Health Records is a system that allows Albertans who are 15 years of age or older access some of their healthcare records, some of your lab results, to your test results. You can see right through the provincial record system called Netcare. So you can log in there to get that set up. You can also receive communications and communicate with your doctor right from the same place. So if you have any files you wanted to share with your doctor, you can do that using Secure Mail. And this was built by the provincial government of Alberta to help give patients access to information, because when you have more access to your information or more complete access to your information, you're actually able to be a healthier patient. So you're able to be more engaged, you're able to have better conversations with your physicians or your healthcare team members, because you have the information at your fingertips as well. It's less of a one-sided conversation. You're more involved in your healthcare. So you're actually able to be a healthier person. And there's actually a lot of statistics around showing that people who are engaged are healthier for sure. And the most engaged patients actually cost 20% less than the least engaged patients. So the more engaged we all are as a patient, the more active we are in our healthcare management, and Secure Mail is the perfect tool for that. Then we can actually show great benefit and help bring the cost down so that we can support a viable public healthcare system here in Canada. You can sign up for that through My Health Records through myhealth.alberta.ca. We've sent out a number of messages about it. You will get a link to it in the patient newsletter that'll be coming out in the next 2 weeks as well. And let's see here. We don't have any questions today, so that's great. If you have any questions quickly, please get them in. The winner of our draw today, so for showing up and learning about Secure Mail and what you can do with it, that is going to Myra. So congratulations on that. We'll get you that sent out to you. There's lots of information about Secure Mail. You can watch other videos shortly will be published on our website on the patients page. You can go learn more about what you can do with Secure Mail with your clinic, what your clinic can do for you, and some of the more benefits that we haven't discussed here today. So if you want to get more information about that, And like Mark said, if there are other providers you would like to work with on SecureMail, go to that directory, click that link, send us their information. We'll reach out to them. If we can get them on board, we will. If we're not able to get through, and we're not able to get through to all of them, especially now because it's a little bit tricky. They're fairly busy, but we do make our best effort to get through and get them on the system for you. So certainly do that if there's other members of your healthcare team you'd like to connect with. That brings us to our close today. Hopefully it was helpful for you. And we will be just continuing to do these on a monthly basis with more tips, how you can better engage with your healthcare team and use SecureMail for better health. Thanks again for your time, Mark. Great demo as always, and have a great Wednesday, everybody.
Thanks, everybody. Have a great day. Bye-bye now.